Hello and welcome to our Ultimate Exam Prep course, built perfectly for your upcoming test. I am so happy you are here with me, ready to learn these amazing new skills. We will study together at a steady pace, making sure you feel very comfortable learning everything. You have worked really hard to reach this point, and we will definitely succeed together. This course will give you the exact knowledge you need, preparing you for a great future. Let me show you how simple studying can be, when we review the right information properly. Section 1 starts by looking at basic brain health, exploring how chemicals affect our patient moods. We must understand normal brain function first, before we can safely treat people who feel sick. Psychiatric nurses carefully check physical symptoms, looking for clear clues about what might be causing problems. It really helps to remember how neurotransmitters work, because they control how our entire body feels. I will teach you the exact basics first, helping you build a very strong clinical foundation. You will soon recognize these basic patterns easily, making your nursing practice much safer and better. We also need to talk about patient safety, because keeping people safe is always our goal. When we evaluate a new person in our clinic, we must ask about their living situation. Checking for things like depression or anxiety takes time, but it protects the people we treat. You will learn how to ask the right questions, helping your patients feel heard and understood. We can use standardized screening tools during visits, tracking how well our prescribed treatments are working. I want you to feel confident using these tools, so we will practice them right now. Learning psychiatric nursing takes lots of practice, but taking small steps makes the entire journey easier. You can always pause this video anytime, taking a moment to write down good study notes. We are going to start the practice questions now, checking everything you have learned so far. Please remember to subscribe to my channel right now, supporting the free educational videos we create. You can check the complete course below, and find the offline app link in the description. 1. What specific part of the human brain controls our basic breathing and heart rate? The brainstem directly controls our basic breathing, and it regulates our resting heart rate automatically. This area manages basic life functions, keeping patients alive without them thinking about it at all. 2. Which specific neurotransmitter normally helps people feel happy, relaxed, and completely calm at home? Serotonin acts as the main chemical messenger, balancing human moods and reducing overall stress. When serotonin levels drop too low, patients often report feeling very sad or severely depressed. 3. What common physical symptom usually appears first when a patient experiences acute panic attacks? Patients often describe having a very fast heartbeat, feeling like they cannot breathe normally anymore. Panic triggers a massive fight or flight response, making the heart pump blood much faster. 4. Why do providers carefully review the thyroid levels before diagnosing a patient with major depression? Low thyroid function closely mimics major depression, causing extreme tiredness and severe weight gain rapidly. Checking medical labs prevents misdiagnosis, ensuring we treat the actual physical cause of their symptoms. 5. What is the primary purpose of conducting a thorough mental status examination during initial visits? It provides a clear snapshot of how the patient thinks, feels, and behaves right now. We use this exact baseline to measure future progress, seeing if our treatments actually work. 6. Which specific brain structure stores our long-term memories and helps us learn new things? The hippocampus properly organizes all our fresh memories, storing them safely for future mental access. Damage to this delicate area causes significant memory loss, confusing the patient over passing time. 7. How does the sympathetic nervous system react when a person faces immediate physical danger? It releases extra adrenaline into the bloodstream, preparing the entire body to fight or run. You will notice dilated pupils and heavy sweating, signaling a huge biological stress reaction immediately. 8. What is the most reliable way to assess a patient for hidden suicidal thoughts safely? You must directly ask the patient if they have any plans to hurt themselves soon. Direct questions do not plant bad ideas, but they do save precious lives every day. 9. Which detailed psychiatric screening tool is widely used to evaluate memory and cognitive decline quickly? The mini mental state examination tests basic orientation, helping nurses detect early signs of dementia. Providers ask simple orientation questions, checking if the patient knows their current location and time. 10. What specific biological process removes extra neurotransmitters from the synaptic cleft after sending a message? Reuptake pumps pull the leftover chemicals back inside, cleaning the empty space for new messages. Many modern medications block this exact process, leaving more chemicals available to improve patient moods. 11. Why must psychiatric nurses strictly maintain professional boundaries while treating highly emotional mental health patients? Clear boundaries protect both the patient and the nurse, keeping the therapeutic relationship totally safe. Without firm boundaries established, patients might easily misunderstand our medical care as personal romantic friendship. 12. What specific symptoms strongly suggests a patient might be experiencing early onset of schizophrenia symptoms? The patient may suddenly start hearing imaginary voices, believing things that are simply not real. We call these strange experiences auditory hallucinations, and they require immediate medical attention and treatment. 13. How does the parasympathetic nervous system help our human body recover after a stressful event? It slows down the racing heartbeat, helping the patient digest food and finally rest peacefully. Rest, recover, we need to relax, bringing the entire system back to a normal state. 14. What is the most common reason why patients decide to suddenly stop taking psychiatric medications? They experience very uncomfortable side effects, deciding the medicine feels much worse than their illness. Nurses must educate patients about potential side effects beforehand, reducing the chance of sudden stopping. 15. Which specific brain lobe is responsible for complex decision-making, impulse control, and social behavior? The frontal lobe heavily manages our daily planning, filtering out socially inappropriate thoughts and actions. When people suffer frontal lobe injuries, they often behave very impulsively without thinking things through. 16. What exactly is a delusion, and how does it affect a severely ill psychiatric patient? A delusion is a strongly held false belief, which the patient believes is entirely true. Even when presented with absolute logical proof, the patient will refuse to change their mind. 17. Why is building strong rapport considered the most necessary first step in any psychiatric assessment? Patients will only share their deepest hidden feelings if they truly trust the listening nurse. Building trust early creates a wonderful therapeutic environment, encouraging totally honest and open patient communication. 18. What does the term pharmacokinetics mean when nurses study new psychiatric medications for their patients? It describes exactly how the human body absorbs, distributes, and finally removes the given drug. Knowing this specific timeline helps us predict when the medication will start working for them. 19. How should a professional psychiatric nurse respond when a patient begins crying during an interview? The nurse should quietly offer a soft tissue, sitting calmly while the patient expresses feelings. Allowing the patient time to cry shows immense respect, providing him a perfectly safe space. Welcome back to our study session, as we continue learning together at a comfortable pace. I am so proud of your hard work, and we are making really great progress. Section 2 focuses on psychiatric medications, teaching you how to safely prescribe drugs for patients. Understanding these chemical treatments helps us heal people, bringing them back to a normal life. We must always start with the lowest possible dose, watching carefully for any bad reactions. Every patient processes medicine slightly differently, so we check their lab results very often. Teaching patients about their daily pills keeps them safe, preventing dangerous mistakes at home. You will learn to recognize drug interactions quickly, stopping major medical problems before they happen. Keeping track of side effects takes careful attention, but it makes you a wonderful nurse. You are doing fantastic, and we will finish this next practice section together very easily. Please remember to subscribe right now, and check the complete course link in the description. Let us start practicing the next set of questions, building your clinical confidence even more. 20. Which specific class of medications do providers usually prescribe first to treat severe daily anxiety? Providers frequently prescribe selective serotonin reuptake inhibitors because they are very safe for daily use. These medicines slowly build up inside the brain, providing steady relief without causing drug addiction. 21. Why must patients completely avoid eating aged cheese while taking monoamine oxidase inhibitor medications? Eating aged cheese with this specific medicine causes a sudden and highly dangerous blood pressure spike. Tyramine builds up quickly in the blood, leading to severe headaches and terrible heart problems. 22. What is a very common side effect when patients begin taking lithium for bipolar disorder? Patients often notice a fine hand tremor, and they might feel thirsty much more frequently. We carefully check lithium levels in their blood, making sure the dose stays perfectly safe. 23. How do typical antipsychotic medications help patients who are suffering from severe acute schizophrenia? They block dopamine receptors inside the brain, stopping the scary voices and confusing false beliefs. Lowering dopamine calms the active human brain, helping the person think clearly and logically again. 24. What dangerous medical condition can happen if a patient takes too much serotonin-boosting medicine? The patient might develop serotonin syndrome, causing a very high fever and rigid tight muscles. Stop, assess, we need to call, act, because this emergency requires immediate hospital care always. 25. Why do doctors slowly decrease the dose of certain psychiatric medicines instead of stopping suddenly? Stopping pills too fast causes terrible withdrawal symptoms, making the poor patient feel extremely sick. Slowly lowering the daily amount gives the brain time, letting it adjust to working normally. 26. What specific blood test must providers check regularly when prescribing clozapine for treatment-resistant schizophrenia? We must check their absolute neutrophil count, ensuring their immune system remains strong and healthy. Clozapine can suddenly destroy white blood cells, leaving the patient unable to fight simple infections. 27. Which medication is often given as an emergency injection to calm a highly aggressive patient? Nurses often administer intramuscular haloperidol, because it works very rapidly to calm the angry brain. We use this strong medicine carefully, protecting both the upset patient and the hospital staff. 28. How long does it usually take for standard depression medications to show maximum positive effects? It normally takes about 4 to 6 weeks before the patient feels completely better mentally. We must encourage them to keep taking it, even when they feel no changes initially. 29. What serious movement disorder can happen after taking older antipsychotic medications for many long years? Patients might develop tardive dyskinesia, causing them to smack their lips and move uncontrollably. Catching these strange movements early helps us change their medicine, preventing permanent physical muscle damage. 30. Why do providers often prescribe sleep medications only for a very short period of time? Sleep pills can become highly addictive quickly, making natural sleep completely impossible without using them. We prefer teaching good sleep habits first, keeping the human brain chemically healthy and independent. 31. What specific physical check must nurses perform before giving a child stimulant medicine for ADHD? Nurses must check the child's height and weight, ensuring the medicine does not stop growth. Stimulants often reduce the natural appetite completely, making the small child skip important daily meals. 32. Which specific psychiatric drug is uniquely known to lower the risk of suicide in patients? Lithium is very famous for protecting patients, significantly lowering their thoughts of hurting themselves safely. Keeping the mood stable prevents deep crashes, giving the person hope for a better tomorrow. 33. What happens if a patient mixes their prescribed anti-anxiety medicine with a lot of alcohol? Their breathing can slow down very dangerously, causing them to pass out or even die. Both substances relax the human nervous system, creating a deadly combination when used carelessly together. 34. Why is it helpful to give long-acting medicine injections to certain struggling psychiatric patients? Monthly injections remove the heavy burden, meaning patients never have to remember daily morning pills. This keeps their medicine levels perfectly steady, keeping them happily out of the emergency room. 35. What specific vitamin deficiency can cause memory problems that look exactly like serious elderly dementia? A severe lack of vitamin B12 damages nerves, causing extreme confusion and terrible memory loss. We simply check their blood vitamin levels, fixing the problem easily with cheap dietary supplements. 36. How do providers usually treat an older patient experiencing sudden and severe state of delirium? We must find the hidden medical cause, like a simple urinary infection making them confused. Curing the underlying hidden body infection quickly usually clears their confused mind within a week. 37. Which popular herbal supplement do patients sometimes take to treat mild depression on their own? Many people buy St. John's wort over the counter, hoping it will improve sad moods. We must ask about all herbal pills, because they interact dangerously with our prescribed medicines. 38. What is the very first step when a provider discovers a patient is taking dangerous drugs? The provider must stay calm and listen, building deep trust without judging the sick patient. Safe, honest, we need to talk, plan, creating open conversations helps successful addiction recovery programs. Welcome back to our wonderful study class, learning new things to help your future patients. I am so glad you are here, continuing this amazing journey together at our steady pace. We are making really great progress now, building the confidence you need for your exam. Let us keep up this excellent work, moving carefully through our next set of psychiatric topics. Section 3 focuses on evaluating different patients, looking closely at how their mental health disorders present. We will explore common symptoms they show, giving you the tools to figure out their problems. Proper assessment is the best starting point, ensuring we always pick the right treatment plan carefully. You will learn to spot hidden clues, helping you diagnose people with much better clinical accuracy. Taking your time during evaluations really helps, preventing silly mistakes that could hurt someone under your care. We will start our new practice questions now, checking the knowledge you just gained with me. Please take a moment to subscribe right now, supporting my channel and these free educational videos. Remember to check the complete course below, and find the offline app link in the video description. 39. What specific psychiatric disorder causes a person to experience extreme high moods and very low crashes? Bipolar disorder makes patients suffer from wild mood swings, completely changing their daily energy levels. These sudden energy changes disrupt their normal lives, requiring strong mood-stabilizing medicine for proper balance. 40. How long must a patient feel intensely sad before doctors diagnose them with major depressive disorder? The patient must experience very deep sadness daily, lasting for at least 2 full weeks continuously. This persistent sadness stops them from enjoying life, making simple daily tasks feel completely impossible. 41. What is a common physical sign that a young patient might be struggling with anorexia nervosa? The patient usually becomes extremely thin quickly, refusing to eat normal meals with their loving family. They develop a terrible fear of gaining weight, seeing themselves as heavy despite being dangerously thin. 42. Which exact anxiety disorder causes people to wash their hands repeatedly for many hours every day? Obsessive-compulsive disorder forces people to perform strange repetitive actions, trying to stop their scary thoughts. Wash, clean, we need to scrub, repeat, because stopping the action causes them intense mental pain. 43. Why do patients with post-traumatic stress disorder try to completely avoid loud noises and crowds? Loud sudden noises can trigger terrible flashbacks, making them feel like they are reliving bad trauma. Their brain stays on very high alert constantly, trying to protect them from imaginary future danger. 44. What specific mental condition makes a patient falsely believe the government is constantly watching their house? Schizophrenia often causes these scary paranoid delusions, making the patient feel hunted by completely unseen forces. We must gently validate their real emotional fear, without actually agreeing that the false belief is true. 45. Which personality disorder causes patients to have highly unstable relationships and a huge fear of abandonment? Borderline personality disorder makes people feel empty inside, causing extreme emotional reactions to very small problems. They might suddenly hate their favorite nurse, splitting their feelings between totally perfect and completely evil. 46. What specific behavior often shows that a young child might be suffering from autism spectrum disorder? The child usually avoids making direct eye contact, preferring to play completely alone with spinning toys. They struggle to understand normal social cues, finding crowded social situations very overwhelming and physically painful. 47. How do providers recognize a generalized anxiety disorder in an otherwise healthy middle-aged adult patient? The patient worries excessively about everyday normal things, feeling very tense for at least 6 months. This constant worrying ruins their normal sleep cycle, leaving them feeling completely exhausted and easily annoyed. 48. What is the most noticeable symptom when an older patient starts developing early-stage Alzheimer's disease? They start forgetting recent conversations very quickly, asking the exact same questions over and over again. Their short-term memory begins failing first, while they perfectly remember things from their distant childhood. 49. Which eating disorder involves secretly eating huge amounts of food and then throwing it up purposefully? Bulimia nervosa traps patients in a terrible cycle, binging on junk food and purging it later. This dangerous vomiting destroys their tooth enamel rapidly, and it causes severe heart rhythm problems eventually. 50. Why might a patient with severe panic disorder suddenly stop going to the local grocery store? They develop a condition called agoraphobia, fearing they will have a panic attack in public places. The fear of being trapped becomes so strong, they decide staying safely home is their only option. 51. What specific medical term describes a patient who physically cannot speak after experiencing a terrible shock? We call this condition severe mutism, occurring when extreme emotional stress shuts down normal vocal cords. The body tries to protect the fragile mind, forcing total silence until the person feels perfectly safe. 52. Which specific childhood condition causes a student to constantly interrupt their teacher during quiet class time? Attention deficit hyperactivity disorder makes children very impulsive, forcing them to blurt out answers without waiting. These kids really want to behave nicely, but their busy brains cannot control their sudden actions. 53. How does a patient with illness anxiety disorder usually react to a tiny scratch on their arm? They become completely convinced they have a deadly infection, demanding immediate antibiotics from the emergency room. Normal bodily sensations cause them extreme mental terror, perfectly convinced they are dying from rare diseases. 54. What hidden condition might cause an older man to drink alcohol heavily every single lonely night? He is likely suffering from undiagnosed major depression, using cheap alcohol to numb his deep sadness. Many older adults self-medicate their emotional pain, hiding their severe depression behind heavy daily drinking. 55. Which specific mental disorder involves having multiple distinct personalities living inside one single human body? Dissociative identity disorder fractures the human mind, creating completely separate identities to handle severe childhood trauma. These different personalities take total control suddenly, causing the patient to lose large chunks of passing time. 56. What specific symptom separates a scary manic episode from a normal state of being very happy? A manic patient will stay awake for days, feeling absolutely no need to sleep or rest. This dangerous lack of sleep destroys their reasoning, making them spend all their money very foolishly. 57. How do psychiatric nurses quickly identify if a sad patient is experiencing a true psychiatric emergency? The nurse strictly asks if they have a specific plan, checking if they intend to commit suicide. Having a deadly plan requires immediate hospital admission, keeping the person completely safe until they feel better. Welcome back to our fun learning journey, getting you perfectly ready for your big exam. I am thrilled you are still here with me, studying hard to help future patients. We will explore different therapy styles now, learning how talking heals the human mind safely. Section 4 looks closely at psychological therapies, teaching you ways to guide people through sadness. Giving patients a safe space to talk helps them process their hidden pain much better. You will quickly learn amazing counseling skills, helping your patients build wonderful lives for themselves. We must practice active listening every single time, showing our patients we truly care deeply. Now we will start our new practice questions, checking all the great things you learned. Please take a second to subscribe now, and find the offline app link right below. 58. Which specific talking therapy helps patients change their negative thoughts to improve their overall mood? Cognitive behavioral therapy directly changes bad thinking patterns, helping the patient feel much happier instantly. Changing thoughts fixes broken feelings, bringing a wonderful sense of peace to the tired mind. 59. How does a therapist use exposure therapy to treat someone with a severe dog phobia? The therapist slowly introduces safe dogs to the patient, reducing their intense fear over time. Small steps build great courage, proving to the frightened patient that they are completely safe. 60. What is the main goal when using dialectical behavior therapy for borderline personality disorder patients? It teaches them to accept their intense feelings, while changing their destructive behavioral responses safely. Stop, think, we need to breathe, act, creating a peaceful pause before making bad decisions. 61. Why do many therapists strongly encourage families to join group therapy sessions with the patient? Families learn how to support their sick loved one, creating a healthier home environment together. Healing the whole family system stops bad communication habits, making recovery much faster for everyone. 62. What specific action should a nurse take when a therapy group member starts yelling loudly? The nurse must quickly calm the angry person, protecting the other group members from harm. Keeping the therapy space entirely safe remains our top priority during every single group meeting. 63. How does psychoanalysis try to heal a patient suffering from deeply hidden childhood emotional trauma? It brings buried childhood memories into the conscious mind, allowing the adult to finally heal. Exploring the distant past helps patients understand why they feel so broken in the present. 64. Which specific therapy focuses entirely on finding quick solutions instead of analyzing past childhood problems? Solution-focused brief therapy looks only at future goals, ignoring the messy past problems completely. We focus strictly on building a wonderful future, helping the patient move forward very quickly. 65. What is the primary purpose of using eye movement desensitization and reprocessing for trauma patients? It uses guided eye movements to help the brain safely process terrible memories from trauma. This special eye movement tricks the nervous system, completely turning off the panic alarm bells. 66. Why must a professional counselor always keep patient secrets completely private during normal therapy sessions? Strict privacy builds unbreakable trust, allowing the scared patient to share their deepest hidden feelings. If we break their trust even once, they will never share their honest feelings again. 67. What exception legally forces a trusted therapist to break patient confidentiality during a private session? We must break privacy if the patient threatens to seriously hurt themselves or someone else. Saving a human life always remains much more important than keeping a simple private secret. 68. How does interpersonal therapy directly help a patient struggling with a very difficult recent divorce? It fixes their broken communication skills, helping them build much healthier relationships moving forward now. Better social skills lead to stronger friendships, completely curing the lonely sadness they feel inside. 69. What does unconditional positive regard mean when talking to a very difficult mental health patient? It means we must always support the patient warmly, no matter what terrible things happen. Showing them pure kindness without judgment helps them learn to love themselves slowly over time. 70. Why do providers often use play therapy when trying to help deeply traumatized young children? Small children cannot explain their complex feelings with words, so they use toys to communicate. Watching them play with dolls reveals their secret fears, letting us gently heal their pain. 71. What specific term describes a patient transferring their anger for their father onto the therapist? This psychological process is called transference, happening when old feelings are placed on new people. We gently point out this mixed emotional reaction, helping them understand their hidden family anger. 72. How does mindfulness-based cognitive therapy prevent patients from falling back into deep depression cycles? It teaches them to notice sad thoughts quickly, without letting the sadness control their actions. Notice, accept, we need to release, breathe, letting the dark clouds pass by without harm. 73. What is the main focus of existential therapy when helping an older patient facing death? It helps the dying patient find deep personal meaning, making them feel their life mattered. Finding true purpose removes the heavy fear of death, bringing peaceful closure to their mind. 74. Why do we teach progressive muscle relaxation to patients suffering from severe physical anxiety symptoms? Tightening and relaxing muscles proves to the patient they can easily control their physical stress. A relaxed body naturally calms a racing mind, completely stopping the painful anxiety attack fast. 75. How does motivational interviewing help a stubborn patient who completely refuses to stop drinking alcohol? It gently explores their personal reasons for changing, without arguing or forcing them to quit. When they find their own internal motivation, they will finally choose to stop drinking permanently. 76. What is the main benefit of using a token economy system in a psychiatric hospital? Giving small rewards for good behavior encourages difficult patients to follow the hospital rules nicely. Positive rewards work much better than harsh punishments, building a friendly and cooperative healing space. Welcome back to our nursing course, moving closer to passing your big final exam soon. I am very proud of you, seeing how much effort you put into studying daily. We will explore special populations now, learning to treat different ages with loving medical care. Section 5 covers vulnerable patients, looking closely at treating older adults and very young children. Children need completely different medicines, because their growing brains react uniquely to strong psychiatric chemicals. You must protect older adults carefully, always checking their weak kidneys before prescribing heavy pills. Taking care of pregnant women matters, keeping both the mother and growing baby perfectly safe. I will help you practice these rules, building your knowledge base for the upcoming test. Please take a second to subscribe, and check the offline app link in the description. 77. What specific psychiatric medicine must pregnant women avoid completely during their early first trimester? Pregnant women must strictly avoid lithium, because it causes terrible heart defects in the baby. Protecting the baby is our priority, forcing doctors to choose much safer medication options always. 78. How does severe depression usually present differently in young children compared to older adult patients? Depressed children often seem very angry constantly, throwing loud temper tantrums instead of crying quietly. Children lack the words to explain deep sadness, showing their terrible emotional pain through anger. 79. Why do older adults experience much worse side effects from standard doses of psychiatric medicines? Their aging livers process chemicals very slowly, causing the drug to build up dangerously high. Start slow, we need to watch, wait, keeping the dose tiny to prevent dangerous falls. 80. Which exact therapy style works best for a teenager suffering from severe self-harm behaviors? Dialectical behavior therapy helps teenagers deeply, teaching them to handle intense feelings without cutting themselves. It gives them safe coping tools, replacing their painful actions with much healthier emotional responses. 81. What common physical problem often mimics severe anxiety symptoms in healthy middle-aged female patients? An overactive thyroid gland perfectly mimics panic attacks, causing a racing heart and extreme sweating. We always run a full blood test, ensuring we catch physical problems before prescribing pills. 82. Why must providers closely monitor a child taking antidepressants for suddenly worsening suicidal thought patterns? These pills give depressed children sudden high energy, giving them strength to attempt dangerous suicide. We watch them very carefully early on, keeping them completely safe while the medicine adjusts. 83. What is the very first step when treating a pregnant mother experiencing postpartum psychosis safely? We must immediately separate the sick mother from her baby, admitting her to the hospital. This severe illness causes terrible delusions, making the confused mother a huge danger to newborns. 84. How should a nurse communicate with a highly confused elderly patient suffering from advanced dementia? The nurse must speak very slowly and calmly, using short sentences and a gentle tone. Loud noises and complex instructions will only terrify them, making their confusion much worse instantly. 85. Which specific legal rule protects an older patient from being restrained to their hospital bed? Federal laws strictly forbid using physical restraints, unless it is a terrible emergency saving lives. Tying older people down causes immense fear, leading to severe physical injuries and horrible trauma. 86. What is the most common reason a teenager refuses to take their prescribed ADHD medicine? Teenagers often hate feeling different from their friends, believing the medicine changes their real personality. They want to fit in perfectly naturally, choosing peer acceptance over good grades in school. 87. Why is grief counseling strongly recommended for a healthy person who just lost their spouse? Talking through the deep pain prevents normal grief from turning into a major depressive disorder. Expressing their sad feelings immediately provides huge relief, helping them rebuild their lonely life eventually. 88. What hidden sign often alerts a smart school nurse that a young student faces bullying? The bullied child frequently visits the quiet clinic, complaining about fake stomachaches to escape class. School becomes a completely terrifying place, causing real physical sickness from extreme social anxiety daily. 89. Which exact eating disorder commonly affects young female athletes trying to perform perfectly in sports? Anorexia nervosa targets teenage athletes heavily, convincing them that losing weight improves their athletic speed. This dangerous belief ruins their physical health quickly, eventually destroying their strong heart muscle forever. 90. How do medical providers properly assess a young child for early signs of physical abuse? We look for strange bruises shaped like belts, or burns that look like hot cigarettes. If we suspect bad abuse is happening, we must legally report it to the police. 91. Why do many older adults accidentally overdose on their prescribed psychiatric medications at their homes? Poor eyesight and terrible memory problems make them forget they took their early morning pills. Using a simple daily pill box solves this problem, keeping the daily doses perfectly safe always. 92. What special therapy technique helps young kids process a massive natural disaster destroying their town? Group art therapy allows scared kids to draw their feelings, sharing the scary trauma together. Seeing other kids drawing similar scary pictures proves to them they are never alone anymore. 93. Why is treating substance abuse in teenagers much harder than treating it in adult patients? A teenage brain lacks strong impulse control, making it incredibly hard to resist drug cravings. Their brains are still growing rapidly, requiring specialized teenage rehab centers for actual lasting success. 94. What symptom helps nurses recognize when an elderly patient experiences major depression instead of dementia? A depressed older adult will clearly complain about memory loss, while dementia patients deny it. Depression makes them hyper-aware of failures, while dementia hides the failure from their mind. 95. How does family therapy improve the long-term outcome for a child diagnosed with schizophrenia? It teaches parents how to manage severe outbursts calmly, keeping the frightened child entirely safe. Educated, calm, we need to support, love, building a protective shield around the vulnerable child. Welcome back to the final part of our wonderful nursing exam prep course together. I am incredibly proud of your hard work, and we are almost completely finished now. We will finish strong, ensuring you feel completely ready for your big test soon. You have learned so much with me, and your future patients will benefit greatly. Section 6 covers professional nursing roles, focusing on strict legal rules and hospital ethical duties. We must always follow the law perfectly, protecting both our patients and our nursing license. You will learn about patient privacy rights, discovering how to handle very difficult ethical choices. Understanding these legal boundaries helps you work safely, keeping your daily clinical practice perfectly secure. Making tough clinical decisions requires deep thought, but knowing the rules makes it much easier. I want you to practice these questions carefully, testing your brand new professional legal knowledge. Please remember to subscribe to my channel now, supporting the completely free videos we share. You can check the complete course below, and find the offline app link right there. 96. What specific legal document allows a patient to refuse unwanted medical treatments before getting sick? An advance directive states their exact wishes, legally blocking treatments they do not ever want. This protects their personal choices completely, ensuring doctors respect their private wishes during medical emergencies. 97. Why must a psychiatric nurse report a colleague who frequently steals medication from the hospital? Nurses have a strict legal duty, requiring them to report bad behavior to protect patients. Stop, report, we need to protect, act, keeping the entire hospital environment perfectly safe always. 98. What does the term informed consent actually mean before starting a brand new psychiatric medication? The provider must explain all potential risks, allowing the patient to accept or refuse freely. Patients deserve total honesty about their pills, helping them make smart choices for their bodies. 99. How does the strict HIPAA law protect a mental health patient returning to their workplace? It prevents the hospital from sharing medical secrets, keeping their private diagnosis hidden from bosses. Medical privacy prevents terrible social discrimination, allowing the healed patient to resume working completely normally. 100. What is a clear example of nursing negligence while caring for a highly suicidal patient? Forgetting to check their room every 15 minutes is a terrible act of medical negligence. Skipping these mandatory safety checks puts the fragile patient in huge danger of sudden harm. 101. When is a psychiatric hospital legally allowed to admit a patient totally against their will? Doctors can force a hospital admission if the patient threatens to quickly kill themselves tonight. The immediate threat of death legally overrides their basic freedom, saving their precious life quickly. 102. What does the ethical principle of autonomy mean for a capable adult refusing helpful medicine? Autonomy means the capable adult has the total right to refuse any pill we offer. We must respect their final decision calmly, even when we know the medicine helps greatly. 103. How can a nurse safely demonstrate the ethical concept of justice within a busy clinic? The nurse must treat every single patient equally, regardless of their personal wealth or background. Fairness, respect, we need to balance, care, ensuring poor patients get amazing treatment every time. 104. What is the main difference between medical malpractice and a simple honest mistake at work? Malpractice happens when a trained nurse ignores basic safety rules, causing actual harm to someone. A simple mistake rarely causes major damage, but ignoring strict rules destroys innocent human lives. 105. Why is proper written documentation considered the best legal defense for any working psychiatric nurse? Detailed chart notes clearly prove that you provided excellent care during your entire hospital shift. If you never write it down quickly, the court assumes you never did the work.